Hello everyone. Today we discuss about the concept of quality management system in healthcare management. With liberalizations and globalizations of Indian economy, quality has become a buzzword for survival in the competitive world market. It is obvious that healthcare costs are escalating at a dizzying pace. When cost in manufacturing environment reaches a dangerous proportions, the same is efficiently controlled by quality management techniques to understand um, the complexities of introductions of quality the management in health care services, it is necessary to understand the functioning of hospital system. Hospital system, of course, of this course, you have learned about the concept of hospital as a system. You have learned that a system is a hierarchical chain of system and subsystems inter interconnected and interdependent, having clear objectives at each level of the systems or subsystems, obtained enough inputs from the environment to offset its output. It operates with varying processes or methods to achieve the ultimate objective of the system. You will appreciate that for the efficient management of hospital, the administrator should have a conceptual method model of a hospital which functions as a system and consisting of various services areas as subsystems to achieve ultimate objective of patient care. A large hospital may have 40 to 70 departments which may be functionally grouped under the following systems which I mentioned right now. The system concepts as applied to a hospital will imply collections of departmental subsystems components which operating individually and collectively perform a set of operations in the accomplishment of defined objectives of the hospital system, that is delivery of patient care services. The system concept in management is only a tool which the administrator can use to correct the disorganized resources of machines, materials, and money into a useful and effective institutions. Management is the process whereby those unrelated resources are integrated into a total system of objective accomplishment. Before you proceed further, let us examine a simple model of hospital system as shown. So, you will see that the patient information obtained and fed to the adhesions center, which presents or represents the doctor who makes the diagnosis. He in turn orders certain supplies and services for diagnosis and therapy. These supplies and services are checked and administered by the doctor or his representative, the nurse, the second decision center, as well as the first decision center, regulates the flow of patients' stay in the hospital. Statistical data obtained from medical records of discharged patient provides further information to the decision and centers for planning of the future services. The regulatory function is accomplished by decision centers through their control on the action center, that is, all departmental subsystems in the organization involved in patient care. For simplicity, it is not possible to show all the action centers, but their existence is apparent by the fact that there is recovery or output rate, which is possible only with the assistance of all supportive, utility, and business services. You may have observed the following salient features in the model of hospital systems which are very relevant for the quality management system. There is a continuous flow of information from the time of patient's admission till after discharge, which are essential for decision making. Each subsystem, that is ward, unit as shown, has a clear objective and obtains input from its environment, both internal and external, and operates with varying processes or methods to achieve an output or ultimate objective of system. There are decision centers, both doctors and administrators, who control input and output, rate of patients, supplies, and services also. A clear cut feedback system is available for the users for planning, monitoring, evaluation, and decision making also. Medical records play a vital role in providing patients care related data for both professional and administrative management. Now, ISO 9000 Quality Management System. Quality management is concerned with all activities of the overall management functions that determine the quality policy, objective, and responsibilities, and implement them by means such as quality planning, quality control, quality assurance, and quality improvement. Quality management is the responsibility of all levels of management, but must be led by the top management. Its implementations involves all members of the organization. As already stated earlier, the ISO 9000 series of standards for quality management system have generated maximum interest worldwide, and already 90 centuries have adopted these so far. ISO 9004 is a guide for applications of quality management system. It is in two parts, part 1 for manufacturing sector and part 2 for the service sector like health and hospital services. The quality system is based on the principle that prevention is better than cure. The prime role of quality system is to provide an effective means to assuring that the customer requires are met fully. The system is aimed at firstly to achieve, sustain, and improve the quality of product or service. Secondly, assurance to the management that internal controls are effective. And thirdly, assurance to the customer that the service conforms to his requirement. Now, the main emphasis of ISO 9000 series of standards is on the following that I mentioned right now. Every man is involved in maintaining the quality of the activities that he performs apart from the centralized quality checks. Now, the importance of customer, which has been subdivided into external and internal customers. In the case of hospital, the external customer is the patient or his relations, whereas the internal customer may be an employee or a department receiving receiving product or service from another employee or department. For example, employees or department receiving stores from CSSD, laundry, medical stores, etc., are considered as customers of the issuing departments. Utilizations of intellect of the operator as a matter of fact. Japanese have quality circles in which all members of the team are invited to suggest improvement of the existing system of working procedures. This shows total involvement of all employees working in organization. Now, continuous improvement is yet another important aspect that the Japanese call Kaizen quality management system incorporates various methods like management review, internal audit, and statistical techniques for meaning that assuring or assessing the quality of the system on a continuous basis to correct deviations. You have come across the terms like quality control, quality assurance in the definition of the term quality management. Quality control refers to the operational techniques and activities that are used to fulfill requirements of quality. It will therefore be clear that quality control techniques applied in quality management are concerned both in monitoring and evaluations of the system, implemented to eliminate causes of unsatisfactory performance at all stages, that is, during input processes and output rate stages, in order to achieve standards of quality and economic effectiveness. Whereas quality assurance is concerned with all the planned and systematic activities implemented within the quality system and demonstrated as needed to provide adequate confidence both internal and external customers, as explained above, that an entity, that is service or product, with fulfilled requirement for quality. In fact, some quality control and quality assurance actions are interrelated and we complementary to each other. The latest terminology used in quality management is total quality management, that is TQM, which has a wider base and is a all pervasive approach to quality management. It is defined as a management approach of an organization centered on quality based on participation of all its members and aiming a long-term success through customers satisfactions and benefits to all members of the organizations and the society. You will note that it has the following elements that I brief right now. The approach is centered on quality. The expressions all its members, designated personnel in all departments and at all levels of organizational structure. The strong and persistent leadership of top management and the educations and training of all members of the organizations are essential for the success of his approach. In this concept of quality management relates to the achievements of all managerial objectives also. The concept benefits to society implies and needed fulfillment of the requirements of the society. Total quality management TQM or parts of it are sometimes called total quality or company wide quality control, that is CWQC, company wide quality control CWQC, or total quality control TQC, and so on. After going through the concept of quality management systems and various technologies used in these connections, you will learn about the expected effects and benefits of ISO 9000 quality management system. Now, clarity of customer requires of product or service, as the service is uh, designed based on market study to fulfill customer needs. Clarity of roles and responsibilities at all levels through system analysis and process study. Clear business objectives and targets, and clarity of services to be delivered at each points. Control over quality of operations through decentralized individual check for quality and centralized quality check by quality control system. Assurance of quality of supplies and services at all stages: input, process, and output. Continued educations and training of personnel. This is to ensure that every man remains confident of his capability to provide results expected, hereby motivated to work. Efficient and effective working method as the new procedure and works. Instructions are based on the quality model prepared by employees themselves. Independent audit of all operations to ensure that the quality system covers all aspects being implemented in the desired manner, and provide continuous feedback to the management for timely correction if required. Now, the benefits, competitive advantages in the market are an increase of image and credibility, expanded and continued market share due to favored publicity by satisfied customers, higher productivity and profitability, and proportionate for reductions of cost of operations by improving efficiency, higher potential for growth, baseline informations for planning future services and initiating improvement, safeguard interest of both providers and receptions or receipts of care due to improved quality care, and supporting documentations, that is database, to meet the challenges in case of complaints registered with customer court. Now, present Indian scenario. The print media has been repeatedly bringing out of the state of the nursing homes as also the public and private hospitals. As per report, public hospital turn into illness factories, and going to the hospital remains a experience nightmarish experience, as can be seen from the following findings: big crowds, long queues, confusing maze like layout, and incomprehensible instructions and tedious procedures, casual diagnosis, rude physicians, rough handling by sole staff, bribe taking by touts, complete absence of accountability, unjustified delays, gross negligence due to callousness and incompetence, and malpractice like unindicated surgery. The private hospitals and nursing homes has been labeled as shrine and mammon. Mammon is known as god of riches. These institutions are thriving in spite of glaring inadequacies in facilities provided therein. As per surgery reports on nursing homes in cities like Bombay, Delhi, Calcutta, Patna, Lucknow, Bangalore, gross inadequacies have been noticed with some variations. In Delhi, for instance, it has been reported that out of estimated 2,000 private nursing homes, over 1,500 are unlicensed. Some major centers of learning do have some appraisal activities, such as periodical publications of statistics relating to patients' load, mortality, and morbidity, clinical conference, and clinico pathology reviews, analysis of fatal cases, and injury into major cases of negligence. These, however, focus on technical aspects such as accuracy in diagnosis, investigations reports, treatment, and regimen, and so on. The legitimacy of the diagnostic and therapeutic procedures adopted related to the cost of care, the problems encountered during the patient stays, the professional and administrative lapses, and so on, are never examined in detail for remedial measures. In general, except a few, the Indian hospitals do not have any quality assurance program to regularly monitor and evaluate the standards of care delivered. You will appreciate that considering the health is a basic human need and right, the hospital board or trustee or an owner of any health institutions has the following obligations: moral, patients interested to be protected, legal, appropriate measures to ensure quality and patient safety, contain the cost of care, identify inadequacies in the system, regulate activities to ensure quality and efficiency by maximum utilizations of resources, assess effectiveness of deliver of services rendered, the causes of the patient malady are multi multidimensional, and the remedy lies in introductions of quality management systems to provide efficient and adequate services both in quality and quantity at minimum cost to the best satisfactions of customers and the society. Organizations of quality management system. According to quality guru W. Edward Demine or Demine, an organization should focus not on bad employees but on bad system. Deming estimates that 94% of all errors are system errors, not employee errors. He further estimates that only 50% of quality improvement opportunity lies in focusing on the performance of people, with the remaining 85% of implementations or impediment of to quality coming from systematic factors that are quality or optionally addressed by involving everyone in the system in the quality improvement activities. One of the most crucial factors for success of any quality system is the commitment of the top management of the organizations. At the outset, it is necessary to take decisions by the top management, that quality management system should be introduced in the organization. Once these crucial decisions is taken in consultations with members of the governing body, medical staff, and administrations, the following steps are necessary before introductions of the quality management program. Organizational analysis, review organizational relationship with the external environment. Today successfully, healthcare organizations must be able to anticipate, understand, and proactively and flexibility respond to change in the dynamic healthcare environment. Examine organizations' internal characteristics and functions. Excellence in patient care requires state of the art professional knowledge, clinical management, governance, and support expertise, and competent and technical skills integrated and coordinated organizations wide to effectively and efficiently respond to patient and family needs. The existing characteristics, that is, its strengths and weaknesses, can be assessed through a review of system, policy, rules, and procedures, and operational statistics. Date of each department in the organizations. Thirdly, identifying and problem area and analysis of the problems to understanding cause and effect relationship. This will help in systematic assessing and improve important functions and work processes and their outcomes also. Now, awareness campaigns and development and quality culture. Corporate culture is the basic pattern of shared belief, behaviors, attitudes, and assumptions acquired over time by members of an organization. And corporate culture impacts on the organizational performance and productivity. For these, it is necessary to create a system of values, beliefs, and behaviors that is individual and team for the success. Training, training of top management to help them in decision making regarding implementations of the quality system. These senior managers are generally the head of departments and will subsequently form the steering committee. Training of senior and middle levels manager who will form the task force of the project team to des- uh, design and develop the quality system best suited for the organizations. Training of all other members of the organizations to familiarize them with the quality system requirements and their role. It is implementations. So that's the end of the video, my friends. If you like my blogs, please subscribe, share, comment my blogs. Thanks again for watching my videos. Have a good day.